what does it actually feel like to use something like a cursor on your computer using your brain?
It's not like I feel the implant or the electrodes. There's no tingling or buzzing. It's almost effortless. I just wanted to go somewhere, and it does.
Welcome, everyone. This is John Stringer from Tesla Owners of Silicon Valley. I have Steven here. He will introduce himself in a quick minute. We have the wonderful privilege of being able to interview Brad, the third patient of Neuralink. We're going to deep dive into his story. We know how this company is just changing people's lives, and this is a great example. Steven's going to provide a quick deep dive into that and how this company is just really changing the world, but we could not be more excited to be here with Brad today. So I'm going to pass it to Steven real quick to just give us a download on Neuralink.
Yeah, hi everyone. Steven Plata, Director of Business Development for Tesla Owner Silicon Valley, and we have, as John mentioned, the third patient of Neuralink, and we'll introduce him here shortly. But if you don't know about Neuralink, Neuralink is a company that Elon Musk founded back in 2016. The purpose of this company is to create a brain-computer interface, so a small implantable device that actually connects to your brain. And the purpose of it, the starting purpose, is to help those with immediate major health issues, whether it's mental health or physical disabilities, and then eventually progress to the point where we're actually having a symbiosis with artificial intelligence. So we see how fast things progress in the world of the Muskonomy, if you will. But this is just a really special interview, and we're honored to have this today.
Let's just welcome Brad to the stage. So Brad, thank you again for being here, but can you tell us about yourself, and we would love to hear more about you.
I am just your friendly neighborhood cyborg. I was pretty unremarkable outside my network until Neuralink put a computer in my brain. I am Brad Smith. I was born in California and grew up in Park City, Utah. I lived in a ski resort town, so I skied every Saturday during the winter. I have been married for about 16 years to Tiffany, the best person I have ever known. We have 3 kids, and we are just trying to figure out how to follow Jesus Christ.
Amen, man. Well, we as we shared before, Neuralink aims to help those with some disabilities today. Like we had the chance to interview Noland, who had a terrible accident that ended up making him ultimately become the first patient of Neuralink. Now, you have ALS. That is ultimately what got you into being Neuralink's third patient as of today. Can you share a little bit about ALS with us?
I have ALS, so my brain works, but my body doesn't. It is a weird disease that attacks the motor neurons in my body. ALS, short for amyotrophic lateral sclerosis, is a progressive neurodegenerative disease that affects nerve cells in the brain and spinal cord, causing muscle weakness and eventually leading to paralysis. It has basically killed me when I got the tracheostomy, and I depend on the ventilator to keep me alive. The only thing I can reliably control is my eyes, so eye gaze was the only option before Neuralink.
Now, is ALS something that could be cured today, or what's being done about it?
There is no cure for ALS or even any treatment. Upon diagnosis, I was told that I would die and I should put my affairs in order. It is a weird death sentence. You might remember the Ice Bucket Challenge in 2014. That was a huge fundraiser for ALS. It really helped fund a lot of research. We have gone from knowing almost nothing to understanding a lot more. We now think it is a group of diseases rather than one, but we still are nowhere near finding a cure. I know a man who spent $1 million of his fortune trying everything to cure himself. He died. I have a lot of hope that machine learning and neural nets will help researchers find something new in the data. Until then, I am really excited that Neuralink is unlocking the brain for people with ALS.
Wow, what an inspiration. Can you just tell me a little bit about when did you discover you had ALS?
As far as ALS, at first I thought it was a dodgeball injury. About January 2018, I tweaked my shoulder in a game of dodgeball with the youth at church. I was trying to hit a young man who really deserved it. I remember thinking that the injury might be serious, but over the next few months it didn't get better. The shoulder kept getting weaker. I finally went to a neurologist and he did some testing on my muscles and nerves, testing whether the nerves carry electricity. He then sat back and said, "You might have ALS, or hopefully a major spinal injury." He then offered a hug. I have never gotten a hug from a doctor before. I tell the story in my book of walking back to my car and driving back to work in a haze of grief. I stopped at a parking lot close to work and cried. I said the most desperate prayer in my life, asking Heavenly Father if this was really ALS. I remember getting a very clear answer. Everything is going to be all right. I joke about how vague that answer was. Like, seriously? That is it? No details. Just a big, trust me. So I told my wife and my business partner that I might have a terminal disease. I went through the process of getting a firm diagnosis. I prayed and went to the temple. I cried a lot. My kids noticed that something was wrong, but I finally had a doctor tell me that I have amyotrophic lateral sclerosis, and there is no real treatment. Just wait for my body to fail. Diagnosis is basically a process of eliminating other causes of your symptoms. I had to get some MRI scans to see if I had a major spinal cord injury, because that could have explained it. It was an excruciatingly emotional few months. I had to think about how I might have ALS and try to keep going in my normal life. I finally got an appointment with the ALS clinic in Phoenix, and they poked and prodded me. Then the doctor looked at me and said, "With 30 years of his experience, I definitely have ALS."
So, Brad, ALS is something that progressively becomes more and more part of your life. But what was life like before you were aware that you had ALS? And then also, it's something that you can somewhat prepare for as well. So how did you prepare for it? And then how did it impact your life?
I was just a normal entrepreneurial guy before ALS. I found a love of fast-growing company life at Skullcandy. I love the operations side of the fast-growing business, so I tried to find that again after Skullcandy. I spent some time helping with different business ideas, from SaaS to Bluetooth and golf shoes to Shopify. I moved to Arizona for a company with Tiffany's cousin. It was more than a coincidence that I went to the same hospital for ALS that Neuralink would use a few years later. I prepared for ALS by living my life and going where God asked us to go. There's no way to really prepare for a sudden death sentence, but I look back and see how God prepared us for it. We had to deal with medical problems with our kids. In the end, it didn't turn out that bad. So we learned to keep things in perspective early in our family life. ALS has obviously affected my life. It took me from young and productive to a vegetable in just 2 years. It was faster than most car loans. It was a fast and slow decline. Every day something changed. It is not describable how it feels to lose control of your body.
Wow, what a powerful story, Brad. I can only imagine what that's like. For you personally, how did you first learn about Neuralink and the brain-computer interface (BCI) technology?
I have been following the Elon company world for a long time. I looked for the first mention of Neuralink, and it was in early 2017, while the company was founded in June 2016. I probably didn't really pay attention until it was personal to me. I don't remember how I found it originally, but I bought a used Tesla Model S with a P1 in 2017, so I was thinking about Elon for years before that. I was very interested in BCI after ALS. I knew that I would lose control of my movement and thus lose any computer control. So I was really excited about BCI.
Yeah, it's exciting stuff, but it's got to be a little bit scary. What made you ultimately decide to participate in the Neuralink clinical trial?
I really wanted to use a computer better and faster. I can do almost everything with a computer. You saw the video I edited with iMovie. Neuralink opens up so many options for me. I am always an early adopter of technology, so I was excited to do this. You are all technical guys. Imagine being stuck with a mediocre Windows computer that costs $20,000 to Medicare. That is what Tobii Dynavox does. With Neuralink, I get access to the whole world from my bed.
Wow, thank you for sharing that. As you prepared for the clinical surgery, what was it like to get a call from Elon Musk and DJ?
Elon is just a nice guy. DJ is also great. You saw in the Ashley Vance video, DJ came over and did the call on his phone. I had prepared a text to say, thanking him for being an innovator that my boys can look up to. I did a few sound effects to make him laugh. Elon thanked us for helping Neuralink and joked with the kids. He showed little X playing on the floor. He was really kind and grateful for our participation in this study. I thanked him for making this possible.
Yeah, it's truly inspiring to see all the things that Elon's doing, Neuralink especially. Can you tell us a little bit about, walk us through through your experience of getting the implant from the surgery to the recovery period?
The big day started early, 3:30 a.m. to be exact. My whole family came along, turning the hospital trip into a bit of a circus. We got to the hospital by 5 a.m., greeted by the trial staff and a huge security guard, which made me realize how important this trial was. They wheeled me into a completely empty surgical prep ward with 50 beds, moved me from my wheelchair, and took away my communication device. So no more jokes for me. Suddenly, I was surrounded by 10 doctors, including my ALS doctor, who was there to handle the unique challenges of my condition. The anesthesiologist explained everything, then oddly complimented me on how well I was doing. I was just lying there, a vegetable. My kids came in to see me before the surgery, and my daughter Abigail was especially sweet, rubbing my arm multiple times. Then they took me into the operating room, and the next thing I knew, I was waking up hours later. The surgery itself took a few hours, and I had to stay in the hospital for 24 hours for observation. Neuralink was thrilled with the initial data, which was exciting to hear. Recovery, though, was tougher than I expected. The nurse gave me a synthetic narcotic that knocked me out for 2 days straight. I felt like I was in a fog, and it wasn't until a couple of days later that I started feeling normal again. The implant couldn't be charged for a week, so I was limited in what I could do with it during that time. My sister Corey watched the kids while Tiffany dealt with the hospital and recovery logistics. By the time I got my staples out on the Friday after surgery, I was cleared to start charging the implant. That Saturday was a big moment. I could finally use the thing in my head. 3 Neuralink engineers came over to start working with me, and a documentary crew was here to record everything.
So, Brad, one of the most incredible things I think so far, at least in my opinion, besides seeing you actually play with your kids with a Switch, I think that's so cool. But one of the other coolest things about what's been able to come out of having the Neuralink is actually, quote unquote, having your voice back. What was it like to be able to have your voice back?
It is kind of weird to hear my voice again, but people really like to hear my old voice. I have been working with 11 Labs for a long time to recreate the voice. I tried voice banking, which was the recommendation for people with ALS. But 11 Labs did a great clone of my voice from 3 hours of me speaking to my iPhone. I hired a guy on Upwork to clean up the audio, and this is the result. So I enjoy how people react when they hear my old voice again.
Wow. So now, what are some other things, I should say, what are some other things that you've been able to do now that you've had the Neuralink implant so far?
First off, I'm controlling a computer with my mind. The implant connects via Bluetooth and acts like a mouse, letting me move a cursor just by thinking about it. I started with what I called a drunk mouse, barely hitting 3 targets a minute on a screen, but after some training it clicked, like riding a bike. Next up, I'm typing faster, and I'm doing it without my eye gaze device. For years, I've used eye gaze to communicate, but it's slow and doesn't work well outside. With the implant, I'm typing by imagining movements. First my hand, then my tongue, and now I'm clenching my jaw to click. It's wild. I'm making fewer mistakes than with eye gaze, and I wrote parts of my journal with it. One of the coolest moments? Texting from my front porch. Eye gaze fails in sunlight. So I've been stuck in dark rooms like Batman, but the implant doesn't care about light, it's all Bluetooth. So, I'm out in Arizona's sunny weather, texting people, feeling like a normal guy again. I even used the computer in our new shuttle bus while it was moving. That's freedom I haven't had in years. Here's a fun one. I'm playing Mario Kart with my kids. Neuralink hooked up a Nintendo Switch to my computer, and I steer left and right with my brain. It's beta software. A bit sketchy, but I beat my son Lincoln, legit, no kidding. My daughter Abigail swears she won, and Edison might have let me. But man, gaming with my kids? ALS took that away, and Neuralink gave it back. I'm also testing this AI-powered chat app I proposed to Neuralink. It listens to conversations and suggests responses, so I can keep up without typing every word. They added my AI voice, trained on my writing, though it's not quite me yet. It's like having a conversational wingman. My parents called it HAL 9000, which freaked them out when it defended itself. It's still a work in progress, but it's a game changer for someone who can't speak. Another neat trick? I'm controlling a periscope camera to look around. I can't turn my head, so I got this camera that acts like my eyes. With the implant, I'm taking photos and videos, like my family playing croquet. It's crooked, not winning any Oscars, but it's mine, and it's awesome to see the world again. Finally, I'm building tools to help myself and others. I made a custom accessibility keyboard on my Mac for quick keystrokes, like copy and paste, and shared it on my website, alscyborg.com. I also built an app with ChatGPT that checks if I'm okay. If I don't click a box, it alerts my wife, Tiffany. It's empowering to contribute, to feel useful again. From gaming to typing to chilling on my porch, the Neuralink implant is giving me back pieces of my life. It's not perfect. I'm still practicing, and the brain is weird, but it's already doing things I never thought possible.
You've been able to do a lot of things from using your periscope camera to playing games with your kids, but what does it actually feel like to use something like a cursor on your computer using your brain?
When I started training, I'd imagine moving my left hand to hit targets on a screen, and the cursor would wobble around, maybe hitting 3 targets a minute. It was frustrating. But then something clicked. I can't pin it to one moment, but after a few sessions, it started feeling like riding a bike. One day I was imagining wrist movements, and the cursor just went, drawing straighter lines, hitting targets like I'd been doing it forever. It's not like I feel the implant or the electrodes. There's no tingling or buzzing. Now, when I move the cursor, it's almost effortless. I don't think, move left, move right. I just want it to go somewhere, and it does. It's like when you reach for a glass of water without overthinking every muscle movement. Your brain just does it. Clicking is a bit different. I'm clenching my jaw in my mind to left click and raising my eyebrows for right clicks. Thanks to my ALS rewiring my motor cortex, my jaw's the star player, not my hand. It doesn't feel like physically clenching. It's more like intending to do it, like planning to wave at someone without moving. When it works, it's satisfying. There's no physical feedback, but there's a mental flow when it's working, like I'm one with the machine. Playing Mario Kart with my kids, steering with my brain, felt like pure joy, even if I only beat Lincoln once. Typing with my mind, like I'm doing now, feels like I am finally breaking free from the slow slog of eye gaze. It's not perfect, but overall, it's empowering, like getting a piece of myself back. I'm not just a passenger anymore. I'm driving the cursor, gaming, texting from my porch, and even building apps. It's like my brain's been handed a new tool and we're learning to play together.
That's incredible. I have to ask too, what was it like as far as the overall improving of your life and getting back that sense of independence too?
As the third person with this brain-computer interface living with ALS for 6 years, this tech has been a game changer. So, let's dive in and talk about how it's given me a new lease on life. Let me start by saying ALS has taken a lot. my ability to move, speak, or even breathe without help. For years, I've been locked in, relying on eye gaze to type slowly and communicate, stuck in dark rooms, because bright light messes with the tech. But the Neuralink implant? It's like someone handed me a key to break out of that cage, and the impact on my quality of life and independence is huge. First off, I can use a computer anywhere, anytime. The implant connects via Bluetooth, so I'm not tethered to dim lighting like with eye gaze. I've texted from my front porch in Arizona's sunny weather, used the computer in a moving shuttle bus, and even worked outside at my son Lincoln's robotics competition. That freedom to be out in the world, not trapped in a bat cave, feels like reclaiming a piece of normal life. I'm not just a guy stuck indoors anymore, I'm part of the action. Typing with my mind has been a massive boost. I'm moving a cursor and clicking by imagining jaw clenches or eyebrow raises. Yeah, my brain's weird, thanks to ALS rewiring things. I'm faster than eye gaze now, with fewer mistakes, and I've written journal entries, built a website, and even coded apps with this thing. The AI chat app I helped Neuralink develop is another big win. It listens to conversations and suggests responses, so I can keep up without typing every word. They've added my AI voice, trained on my writing, and it's getting closer to sounding like me. When I tested it with my parents, it was like having a wingman, letting me joke and chat in real time. For someone who hasn't spoken in 5 years, that's huge. It's like stepping back into the social world, not just watching from the sidelines. But it's not just the tech, it's the purpose. Working with Neuralink's brilliant team, testing models, and giving feedback makes me feel like I'm part of something bigger. I told their all-hands meeting that this will change lives, and I'm proud to be their lab rat, feeding data to make it better for future patients. That sense of meaning of helping others while helping myself lifts my soul. As I wrote for a documentary, I'm happier despite ALS because of this work, my faith, and my family. Neuralink has given me hope and a way to serve, which is more valuable than any cursor trick.
Wow, it's truly incredible to see how Neuralink has just absolutely changed the game and how you've even been able to contribute. How does it feel to be one of the first humans with a computer interface?
Being one of the first humans with a Neuralink implant feels like a mix of awe, gratitude, and a pinch of surreal responsibility. I mean, I'm a guy with ALS, barely able to move, and yet here I am, controlling a computer with my mind, typing, gaming, even texting from my porch. It's like I've stepped into a Star Trek episode, and I'm the one with the Borg implant, hence my nickname from my brother. Nerd Kudos of Borg. It's humbling to think I'm helping push the boundaries of what's possible. When I spoke to Neuralink's all-hands meeting, I told them their work is changing my life, and I meant it. Gratitude is huge. I'm so thankful for the Neuralink team, brilliant folks, who are in my kitchen decoding my brain, and they treat me like a partner, not a lab rat. I'm grateful for my wife, Tiffany, who handles this circus, and my kids, who keep me grounded. I even told a documentary crew that ALS, as much as it sucks, has made me a better man, a better disciple of Jesus Christ, and brought me closer to my family. Being a Neuralink pioneer feels like part of God's plan, an unexpected answer to prayers that landed us in Arizona, right where the trial happened. But it's not all rosy. There's a weight to being a trailblazer. I'm only the third person, so every move I make, every click, every glitch, is data for the future. I feel a responsibility to give Neuralink as much as I can, especially since I can't speak like the first two participants. We're figuring out how to make this work for ALS patients who are fully locked in, and that's a big deal. There's also a surreal edge. I'm moderately famous now, with my picture in Neuralink's blog and a documentary by Ashley Vance coming out. I'm not ready for full-on fame. My typing's not fast enough to handle the spotlight, but it's weird to think I'm part of history. I'm excited to be public, to shout about this tech that's letting me live more fully. Ultimately, I feel happy, deeply Stupidly happy.
That's incredible. So, Brad, one other interesting thing, and I'm guessing you know a little bit about Nolan as well, but he is also a bold man in his faith, as John and I are as well. But are you familiar with Nolan, who is Neuralink's first patient, and then Alex as well, who's their second patient? And do you know if there's been any improvements in either the procedure process or the hardware since their implants?
Of course, I know Noland and Alex. We text with each other. I played a little prank on a Neuralink engineer with Alex. We are working with Neuralink to improve the system by using it and finding bugs. The actual implant is the same for each of us. The surgeon changed some things about the surgery after the thread issues with Noland, and we are making changes to the software almost daily. I have spent many hours with Neuralink on different models and issues. We are really learning about everything. I have different issues because I can't speak. It is a great collaboration.
Wow, that's truly incredible, especially just to hear you're able to communicate even with the first two patients. So that's incredible. What are some potential ways Neuralink can have an even bigger impact on ALS patients?
Neuralink could push the boundaries even further. The recent approval from the FDA for decoding intended speech could be a massive leap. I've been experimenting with imagining mouth movements to say phrases like, "The birch canoe slid on the smooth planks," hoping the implant can translate that into text or a synthesized voice. ALS steals your voice. And for me, it's been 5 years since I spoke. If Neuralink can crack real-time speech decoding, it'd be like giving us our voices back. Imagine me chatting with my wife, Tiffany, or joking with my kids without typing every word. Scaling this for all ALS patients, especially those fully locked in, would mean faster, natural communication, maybe even over phone calls or in noisy rooms. And an engineer was giddy about analyzing my phoneme data so I know that they're on it, but pushing this to a reliable product could transform social connection for us.
So now, what do you hope your impact will be on the world, not just as Brad, but also as Neuralink's third patient?
I believe that the best thing I can leave to the world is to raise good kids to be good and productive adults. That is the biggest thing that Tiffany and I will contribute to the future. I think of my parents, who raised 4 great kids, and they have influenced people around the world through us. Personally, I am trying to be a better disciple of Jesus Christ. I am far from his ideal, and I apologize for the many times I have fallen short of him, but he has become more important to me as my body has failed. Jesus Christ has covered for my weakness. As the third person with Neuralink, I am trying to be a positive voice in the conversation. I'm trying to be honest about my experience with Neuralink and represent them well. I have had an amazing experience with them. I also hope to shine a light on ALS. It is a horrible group of diseases and destroys thousands of lives every year.
That's truly incredible, and I know that with your story, you will have that impact. What organizations can people donate to for ALS support?
I have made the ALS Family Scholarship, which provides practical career education funding for spouses and children of people with ALS. You can donate at alsfamilyscholarship.org. Otherwise, I encourage people to support the local ALS Association. The Arizona ALS Association has been awesome. I know that they will use it wisely. alsaz.org.
Thank you so much, Brad, for your incredible story. You're truly an inspiration to me, and it's been exciting to unpack the impact that Neuralink has had on you. And I know with your story that you will be able to reach all of those hopes that you listed before. And I love to hear the fact that you have been able to get your
Glad to
voice
be a
back.
guinea pig with a purpose. Turns out my brain's the real MVP.
That is 100% true. And I just am so excited to see how things continue to adapt and how it's awesome that you said that the Neuralink team is treating you like a team member. And so I'm excited to see, the impact that you're going to be able to have on future patients and the work specifically for ALS and Neuralink, how it's going to help other people get their voice back. It's crucial for humanity. It's crucial for people that may have a similar situation and people that haven't had their voice and their voice was taken away from things
Thank you.
like ALS. So it was truly a blessing to have you here today. We will continue to keep you in our thoughts and prayers, and we know that you will continue to have a big impact, and this is just the beginning.
Thanks, but let's not forget, my brain's doing the heavy lifting, literally.
That is completely true. Stephen, did you have any final words?
Yeah, Brad, just thank you again so much for your time. Thank you for shining a light on ALS, for educating us about Neuralink and what they're doing, and just how you have the beautiful spirit within you that is able to go through literally the dark times when you when you had eye gaze, but going through the dark times to just having the spirit of joy within you now is just something that is very inspirational, and I think you'll be able to impact a lot of people, not just through what you're doing with Neuralink, but through your the nature of you as Brad.
So we are going to go ahead and tag Brad on X. We'll also share his X account on the YouTube description. Please make sure to donate to alsfamilyscholarship.org. It will really greatly help him out as well, as they have started this, along with alsaz.org, which is the ALS Arizona Fund as well. So those are two great funds to donate to. So thank you again, Brad, for your time today. Thank you, Tiffany, for helping to make this happen. And we're so excited to watch your journey literally unravel, as this is really just the beginning of the future. And we're so happy that you have, that Elon and his companies have been able to give you back your voice.
Thank you.